All right, let's talk about poop. What does your poop say about your health? Yep, said it, poop. We're going to talk about it because it can give you a lot of good information that you may already know, but unfortunately, a lot of people don't. So let's talk a little bit about how often you should be pooping, what the poop should look like, and even what certain smells may mean. Now, if someone asks you about your bowel habits, the first thing people typically think of is, oh, I'm regular. But do we really know what regular is? Because ideally, you should be having a bowel movement most days of the week. So I like to tell people every day you should plan for a bowel movement. If your routine is pretty consistent, you should also plan for your bowel movement to occur around the same time of day for each day. Now, it's one thing to skip, one day here and there. But if you're skipping multiple days, then this talk is really for you because we need to talk about and potentially in the future talk about some of your bowel habits as far as how you're on the toilet as well. So you already heard me say you should be pooping once a day. Ideally, got it. Skip a day, not that big of a deal. Skipping several days, truly a big deal. But why is a physical therapist talking to you about poop? Because this is more of a problem than what people realize. A lot of people, when they have pelvic floor related conditions, such as pelvic pain, even back pain or hip pain, they oftentimes are constipated. Actually, had some people not too long ago where once we resolved the constipation, back pain resolved, hip pain resolved, pelvic pain resolved. So constipation can be a driving force for individuals having pain. And of course, people think, oh, when they don't poop, just their stomach will hurt. Nope, you just heard me mention other body parts that can hurt in addition to the abdominal region. So if you're not pooping and you're having pain, that could be one of the reasons. So what should your poop look like? We're going to talk about something called the Bristol stool chart, and I'll bring it a little bit closer that way you can see. Because as you can see, we have some poop that is a bit mushier down through here, and then we have other poop that is much firmer up here. If your poop looks like little pellets, like little rabbit droppings, then you more than likely are dehydrated. But if your poop is looking more so like a paste, so think of like peanut butter or even straight diarrhea, more than likely, especially if you don't have any type of sickness such as a viral infection, more than likely you need more fiber. So those are just some general cues to help you identify what you may be lacking in your diet. Water tends to be a big thing. But let's talk about what if your poop looks like this and this. So what if you have both loose stools, more of the diarrhea, and you have the pellets? Well, that means that you may have been chronically constipated because now the looser stool has been able to escape around the pellets. And then sometimes people will notice, hey, I'm having more of the pellet-like poop or harder poop after I have diarrhea for a bowel or after I have looser stools. So just because you're going regularly doesn't mean that you're fully evacuating. So it is important that you at least know, hey, how do I feel? Do I feel like I was able to fully empty? Do I feel as if when I sat down, I was able to fully relax those muscles? Because if you're pushing and you're actually more harmful, a lot of pressure on that area. If you missed the hemorrhoid thing, we talked about hemorrhoids in a video. So make sure you don't increase your risk for hemorrhoids by straining sitting on the toilet. But I told you what your poop should look like. It's more important as to what your poop should look like. So when you're pooping, you want to have poop that is more so like a sausage. So right through here, we consider that to be type 3 or type 4 on the Bristol stool chart. And you also want to make sure that as you are pooping, like I said, you're not straining. So these two, that's where you want to be on that Bristol stool chart, more so having the sausage like, and also if you're noticing like short little hot links, that may be an indication that you may have some pelvic floor dysfunction. It also could be an indication that, you're still dehydrated. So make sure you're giving your body the water that it needs so that way the stool can pass through. And if you're down through here, where it is mushier, you heard me mention you probably need more fiber. So that way you can bulk up the stool and allow for it to pass through because your body needs both hydration and fiber in order to have effective bowel movements. So now that you know what your poop should look like and what it shouldn't look like, let's talk about some of the different odors that may go along with poop. Because there was this saying when I was a kid where it's like people would say beans good for your heart. The more you eat, the more you know where I'm going with that. Well, that actually has some truth to it because certain types of protein, they will actually ferment within the body and reproduce higher amounts of gas. So as it's producing higher amounts of gas, guess what? you might notice that you have to release that gas. So it is not uncommon to notice that they have more gas and that things may be a little smellier. You have a diet that has foods that produce more hydrogen sulfides, such as broccoli, think cauliflower, think onions, garlic, those different foods. Same thing. You may notice that the smell of the odor of the poop is a little bit more pungent. It's a little bit stronger. But everything that I just mentioned, including the beans, including those veggies I just mentioned, those are all wonderful sources of fiber. If you pair those with other sources of fiber, like other fruits and vegetables that don't produce the hydrogen sulfide or even don't ferment like the beans do for the protein, then you may notice that you don't really have that strong of an odor. Of course, it has an odor, but it doesn't have that strong of an odor. And that is usually where you want to sit at. But if you're getting plenty of broccoli, hey, I'm not going to tell you don't eat it because that's a wonderful source of fiber and other nutrients. So when you have a diet that is well balanced with different types of fiber, so think fresh fruits, fresh vegetables, fresh whole grains, then that can help you to, one, increase the fiber, allow for more bulking of the stool, and also for the stool to kind of be swept through the digestive tract, but it also will allow for the stool to not have as foul of an odor. So there are other times as well where you may notice that the odor for your stool is just a bit off. And that may be the sign of a bacterial infection in the gut or even that your body has a virus. So a lot of times people say, hey, when I'm sick, my stool changes. It does. Your body is fighting off some type of sickness or infection. So that, of course, is going to impact your gut health. And you want to make sure that even after the sickness, that you are doing everything you can to help reestablish that. So back to eating plenty of the fresh fruits and veggies, getting your whole fibers in, so that way you can replenish what your body may have lost as it was combating what it considers an invader. So if you didn't think poop was important, poop is extremely important. And I'm talking to poop with most patients. So my patients who come in with headaches, I want to know how often they're pooping because it gives me more information about their diet. It also lets me know, hey, do we have something that may be irritating them that also can be contributing to those headaches? And I want to know my patients who've had surgery, and I've had this happen numerous times. When you have surgery, they give you pain medication. Pain medication, it does what it's supposed to do. It helps to decrease what you are noticing or feeling with pain. But it also decreases GI motility, meaning it decreases the speed in which your food and things that you digest moves through your intestinal tract, which means that the urge to poop may not be there. And if it is, it may be really hard for you to actually go. So keep that in mind. If you're having surgery or if you've had surgery, the painkillers, they make you constipated. Now, some physicians will also give you a stool softener along with it, or you can even talk with them to see whether or not magnesium is going to be helpful. But I tend to tell people, drink plenty of water and also make sure you're getting the fresh fruits and veggies in, getting those whole grains in, so that way you can supply your body with those natural-based fibers directly from your nutritional source from your food. So poop is important across the spectrum, no matter what we're seeing you for with physical therapy. We should be talking about your poop because it gives us more information about your lifestyle, about your diet, about your overall health. So if no one asked you about your poop, now you know more information, and I would love to hear your comments. So if you want to know more about how the body itself interacts and when it comes to our wellness, how pelvic floor can be encompassed with so many different things, or even in other topics related to physical therapy, let me know down in the comments. I'd love to address questions or concerns and also to provide you all with more information. So share this video with a friend and ask them, okay, may not want to ask them, but at least now they'll know about their poop habits so that way they can take better care of themselves and have a better lifestyle.